my name is Heather Sluder, and I'm an FNP student at the University of Memphis. Today is January the 17th, 2024. I'm going to conduct a head-to-toe assessment on my patient, Kaylee. First, I will start by scanning the room. This is where my phone is sitting. Here's the floor, the ceiling, here are the tools that I'll be using, and this is the bench that we will use as a table. Okay, our assessment will begin now. I will begin the assessment by inspecting the skin of the face, neck, posterior and anterior chest, abdomen, upper and lower extremities, looking at color, texture, temperature, moisture, turgor, edema, scars, lesions, bruises, and nevi. I will inspect the head to ensure that it is in a midline position. I will inspect and palpate the scalp for masses, tenderness, lesions, and then I will palpate and inspect the hair for hair color, texture, distribution, manifestations or infestations, and depressions. Next, I will palpate her temporal arteries for any tenderness. Then I will palpate her lymph nodes, starting with preauricular, postauricular, occipital at the base of the skull, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Then I will palpate for team J, looking for any tenderness, crepitus, or subluxation, as well as testing cranial nerve number 5, which is the trigeminal nerve. If you could clench your teeth. Okay, open your mouth, move your jaw side to side. Okay, perfect. Next, I will test the sensory function of cranial nerve number 5, trigeminal. If you will close your eyes and tell me where I touch on your face.
Forehead, cheek, nose, cheek, chin.
Okay, perfect. Good. Now I'll test cranial nerve number 7, which is the facial nerve, looking for facial symmetry, and I'll have her smile, frown, puff your cheeks, puff your lips, raise your eyebrows. Okay, good. Next, I will inspect the ears, looking for symmetry and position of the ears. I will also palpate the pinna and the tragus for any masses, lesions, or tenderness. Next, I will inspect the auditory canal by pulling the pinna up and back. Auditory canal is patent with a tympanic membrane that is pearly gray. Same over here, tympanic membrane is a pearly gray, and the auditory canal is patent. Next, I will test for lateralization using the Weber test. Please let me know if you can hear this bilaterally or if you can only hear on one side or the other.
Both.
Okay. Next, I will do the Renee test. This is testing for bone conduction. I will place this on the mastoid bone behind the ear. When you can no longer hear it, I need you to let me know, and then I'll place it in front. When you can no longer hear it, let me know.
Okay. Okay.
Okay, I'll do the same on this side.
Okay. Okay.
Okay, perfect. Now I'll do the whisper test. If you could cover one ear and tell me what I say.
1, 2, 3.
Okay, other side.
A, B, C.
Perfect. All right. Next, I will inspect her eyes, looking at her eyebrows, her eyelashes, her palpable fissures, looking at the conjunctiva as well as the sclera, looking at color, lesions, or discharge. Next, I will test for cranial nerve number 2, the optic nerve, by using the Snellen chart for gross visual acuity. If you could, close one eye and read the smallest line that you can read.
L, T, F, P, H.
Okay, other side.
LTFPH.
Good, not both.
LTFPH.
Perfect. Now I will test for your peripheral vision. If you could, just look straight over my shoulder and tell me when you can see my fingers.
Okay. Okay.
Perfect. All right, next I will test cranial nerve number 3, which is ocular motor, by doing direct and consensual pupillary response. So just look straight ahead. Okay, good. And now I will do accommodation and convergence. If you could, just look straight at a spot on the wall. Now look at my finger and follow it in. Good. All right, next I will test cranial nerves 3, 4, and 6, which is ocular motor, trochlear, and abducent, by doing the conjugate gaze with EOMs. So if you could, follow my finger with your eyes only. Okay, perfect. All right. Now I will test for red light reflex with using my ophthalmoscope. I will just look straight ahead, find the red light reflex, and follow it in. Good. Their optic disc margins are sharp, and there's no evidence of AV, nicking, or wool spots. Same on this side. Optic disc margins are sharp with no evidence of AV, nicking, or wool spots. All right, next I'll move on to the nose. Looking, it is looking at the size and the symmetry of her nose, making sure there's no deformities. Next, I will test for cranial nerve number 1, olfactory, as well as nasal patency at the same time. So if you could close your eyes and cover one nostril and tell me what you smell.
No polish remover.
Good. All right, other side.
Cinnamon.
Perfect. All right. Next, I'll palpate the frontal and maxillary sinuses for any tenderness. All right. Next, I will move on to the throat and the mouth, looking at or inspecting the lips, the teeth, the gums, the tongue, under the tongue, the palate, the posterior pharynx, and the salivary ducts and tonsils. Can you say ah? Okay, good. That tested for cranial nerve number 9 and 10, which is the glossopharyngeal and vagus nerve. The uvula and soft palate rose upon phonation. And if you could stick your tongue out, move it side to side, up and down. Good. Tongue is midline without any fasciculations, and that tested cranial nerve number 12, which is the hypoglossal. Next, we'll move on to the neck, inspecting that the trachea is in midline position. I will stand behind the patient and palpate for palpate her thyroid, looking for any masses or tenderness. If you could swallow. Okay, good. Other side. Perfect. Okay. Next, I will palpate the carotid artery. Okay, good. Now I will listen for bruits with the bell of my stethoscope. Hold your breath. Good. Hold your breath. Perfect. Okay. Now, moving along to the posterior chest. If you could turn and face the window. All right, so I'll start by inspecting for any obvious deformities and symmetry of the posterior chest, as well as any signs and symptoms of respiratory distress, such as cyanosis, tripod positioning, nasal flaring, tachypnea, retractions, or use of accessory muscles. I will palpate for symmetrical chest expansion. If you could, take a deep breath. Okay, good. Now I will palpate for tactile firmament. When you feel my hands, say 99.
99, 99, 99, 99, 99.
Okay, good. Now I will go ahead and percuss in the intercostal spaces on the posterior lung fields. Good. All right, and now I will go ahead and auscultate her breath sounds, posterior lung fields. Getting the lateral lung fields. Okay, good. Now I will test for egophony. When you hear or feel my stethoscope, say the letter E.
E, 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 E.
Okay, now bronchophony. Whenever you feel my stethoscope, say 99.
99, 99, 99, 99, 99, 99, 99.
Okay, now whisper pectorilically. Whenever you feel my stethoscope, whisper 1, 2, 3. Okay, good deal. Okay, now while you're facing this way, I'm gonna go ahead and evaluate or assess for CVA tenderness. So let me know if this is tender. Okay, now you can turn back and face me. Okay. All right, so now we will start by inspecting her anterior chest, making sure that there are no deformities and making sure everything is symmetric. I will start by doing symmetrical chest expansion. You could take a deep breath. Okay, good job. Now I will palpate for tactile firmament. When you feel my hands, say 99.
99, 99, 99, 99.
Okay, good. All right, now I will listen and over the lung fields. Okay, good. Okay, now moving on to listening to her heart sounds. I will listen with the bell and the bell and the diaphragm. Starting with the bell, we have aortic, which is in the second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herbs, third intercostal space, left sternal border. Tricuspid, tricuspid, fourth intercostal space, left sternal border, and mitral, fifth intercostal space, mid-clavicular line. Do that again with the diaphragm. We have aortic, pulmonic, herbs, tricuspid, and mitral. Now I will locate and palpate PMI. And then I would listen for a full minute. And for the sake of this, she has a regular rate and rhythm of 68 beats per minute. Okay, now if you would, please get on the bench behind us. Lay on your back. Okay, the head of the bed would be elevated 30 to 45 degrees, and this is where I would assess for JVD. If you could look to one side and the other. Okay, no JVD is present. I don't see any evidence of heaves or lifts, and I will palpate over each auscultation point for any thrills. We have aortic, pulmonic, herbs, tricuspid, and mitral. I will go ahead and listen again with the bell and diaphragm on my stethoscope. Aortic, pulmonic, herbs, tricuspid, mitral, aortic, pulmonic, herbs, tricuspid, and mitral. All right, Next, we will go ahead and inspect the size and symmetry and contour of her abdomen. Then I will go ahead and listen with the Bella my stethoscope for any bruits in the aortic artery, renal, iliac, and femoral. Okay, I will listen to bowel sounds in all 4 quadrants. We have right lower, right upper, left upper, and left lower. Okay, now I will go ahead and percuss in those same quadrants. We have right lower, right upper, left upper, and left lower. I will go ahead and palpate in those same areas for any tenderness or masses. Okay, now I'll palpate for her spleen. If you could take a deep breath in. Okay, spleen is not palpable. And then her liver. Take a deep breath in. Okay, good. Liver is not palpable either. All right, you can sit back up. And we will get back on the stool. Okay, we will start with the inspecting both upper and lower extremities for overall warmth, skin integrity, any edema, or any discoloration. I will palpate the joints of the shoulders, the elbows, the wrists, and the fingers for any tenderness, nodules, crepitus, swelling, or redness. I will assess for capillary refill, which is less than 3 seconds. I will palpate or feel for the radial pulses, which are 2+ bilaterally. All right, next we will go ahead and do range of motion of our fingers. So follow along with me. We have flexion, extension, hyperextension, abduction, adduction, and thumb opposition. Okay, for our wrist, we have flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. Okay, good. For your elbows, we have flexion, extension, hyperextension. Good. Now for our shoulders, we have flexion, extension, hyperextension, internal rotation, external rotation. Now switch. Good. And then we have abduction, adduction, and circumduction. Good. All right, we'll go ahead and do the cervical spine while you're sitting. We have flexion, extension, hyperextension. We have lateral flexion, and then we have rotation. Okay, good. All right, so now I'm going to assess the strength of the upper extremity. So if you could squeeze my hand. Perfect. That's a 5 out of 5 bilaterally. Now we will test bicep, push up. All right, good. Now push. Good. That's bicep and tricep, both 5 out of 5. Up and down. Good. Now if you could push my hands in and push my hands out. Good. Shoulder strength is 5 out of 5. If you could shrug against my resistance. Good. That is a 5 out of 5, and that also tests for cranial nerve number 11, the spinal accessory nerve. All right, now if you could, I'm going to have you close your eyes. I'm going to do light touch sensation. I need you to tell me where I touch at on your body, okay?
Arm, thigh, shin, foot.
Okay, good deal. All right, now I'm going to test for vibratory sensation. I'm going to strike this, and I need you to tell me if you can feel this, okay? This is on the proximal ulnar prominence, okay? Same over here.
Yes.
Okay, now I will also test this in the lower extremities. This is the medial malleolus. I need you to tell me if you can feel this.
Yes.
Okay. Well.
Yes.
All right. Good job. All right. now we will go ahead and assess for deep tendon reflexes. We have the brachioradialis, bicep, tricep, brachioradialis, bicep, and relaxed tricep. And then we have patellar, and then we have the Achilles and Babinski, Achilles and Babinski. All right, now looking at the lower extremities, I will go ahead and assess the dorsalis pedal pulses as well as the posterior tibial pulses. Both are 2+. All right, if you could flex, push down, this would be plantar flexion, which is 5 out of 5, and pull up, and that's dorsiflexion, which is 5 out of 5 as well. Push my hands together. Good. Push them apart. Good. That's a hip strength of 5 out of 5 bilaterally. Push my hands back and push them forward. Good. Knees are also a 5 out of 5 bilaterally. All right. Next, I'm going to do graphesthesia and sternognosis. If you could close your eyes. We'll start with sternognosis first. I'm going to have place an object in your hand and I need you to tell me what it is.
Quarter.
Okay.
Battery.
Perfect. All right. While your eyes are still closed, I will draw a figure in your hand and I need you to tell me what it is that I'm drawing.
C.
Okay.
B.
Perfect. All right. And that was graphesthesia. Next, we're going to do test the cerebellar function by doing rapid alternating movements. So first we have finger to thumb, as fast as you can, good. Hand flip-flop, perfect. And then finger to finger. If you could touch your finger, touch your finger, touch your finger, perfect. Okay. Next, I'm going to have you stand up. All right, we will do range of motion of our knees. First, we have flexion, extension, hyperextension. Other side, flexion, extension, hyperextension. Perfect. Now of our hip, we have flexion, extension, hyperextension, abduction, adduction, internal rotation, external rotation, and circumduction. Perfect. Other side, we have flexion, extension, hyperextension. We have abduction, adduction, internal rotation, external rotation, and circumduction. Perfect. All right, now moving along, we will have you turn to the side and bend straight over. This is lumbar flexion, and while she is in this position, we will go ahead and assess her spine and curvature, looking for any scoliosis or deformities, as well as any tenderness. Okay, now stand up. This is extension, and then back is hyperextension. And then we have lateral flexion, side to side, and then rotation. Perfect. Okay, next I will go ahead and assess your gait. If you could just walk normally, straight to the camera. Okay, good. Now turn around and walk heel to toe. This is our tandem gait. Perfect. Now turn and face me. Close your eyes. This is Ronberg's test. We're looking for any swaying, which she is not. Good. Now if you could, hop on one foot and hop on the other. And this concludes our exam. Thank you so much.